I'm suffering from type 2 diabetes. Then the conventional treatment is usually some advice about lifestyle. Maybe you need to change your diet and maybe you need to exercise more. If that is not working over a period of few months, you are usually put on some kind of medication. If the condition progresses, you might be given more tablets and medications, and maybe ultimately you might need to come on insulin to treat your type 2 diabetes. But there's a functional medicine approach to that. And the functional medicine approach to type 2 diabetes is basically keep asking the question, why? Why do you have type 2 diabetes? Well, that's due to insulin resistance. But why do you have insulin resistance? Well, that's quite interesting because insulin resistance can be due to a whole range of issues. Insulin resistance could be due to deficiencies. If you have magnesium deficiency, vitamin D deficiency, fatty acid issues, if your metabolism is not okay, that could be affecting your risk of developing type 2 diabetes. If your gut microbiome is not okay, if your gut bacteria is not balanced, or maybe you're having gut pathogens, maybe even harmful bacteria are residing in your gut, that can affect your risk of developing diabetes. Hormonal issues, if you're hypothyroid, or if your cortisol level is too high, maybe your DHEA level is too low, that can also increase the risk of developing type 2 diabetes. If your sex hormones are off, it's also then associated with type 2 diabetes. There are so many reasons why you might develop type 2 diabetes. And unfortunately, from a conventional perspective, we are more concerned about bringing your blood sugars down rather than saying, why did your blood sugars go up in the first place? And in functional medicine, we dig deeper. We want to understand exactly your situation. Why are you moving towards type 2 diabetes? Why do you have insulin resistance? It could be different from you and it could be different from the next person. So the treatment doesn't necessarily have to be the same. While in conventional medicine, we have an arsenal of medicines and we more or less use the same kind of medicines for most of the patients. But in functional medicine, if it's your gut that is causing the problem, of course, we need to address the gut. If your diet is the problem, then we need to address the diet. But maybe you're having the right diet, but you're not able to digest and absorb the nutrients from the diet. Then we need to address your digestive system and we need to address your absorption. Maybe that is even working fine, but because you're not exposed to sunlight, you're not getting your vitamin D. That could also be a very important trigger for your development of insulin resistance and type 2 diabetes. Maybe it's not even that. Maybe you're so stressed because you're working 12 hours and you don't get time to rest, and then you maybe have responsibilities at home. Maybe you're caring for some elderly parents, or maybe you have other stressors in your life. Those stressors can drive your cortisol level up. A high cortisol level increases the risk of developing diabetes. What is at play in your situation? We don't really know. We just see that your blood sugars are high. And we need to understand why are they high for you. And the treatment needs to be tailored to exactly you and your situation. If you feel that your type 2 diabetes being treated with medicine is maybe not the way you want it to be done, if you want to address the root cause of your diabetes, well, in that case, I strongly suggest that you book a discovery call. The discovery call will give us an opportunity to speak to one another and get to understand one another. Do you feel comfortable working with us? Are we able to help you? Are you wanting or willing to do the changes you need in your life to improve your health, to reduce your insulin resistance and fix your type 2 diabetes? And in many cases, you can even reverse type 2 diabetes. You can get off medicines in many, many cases. Not in all, but in many cases it's possible. If you're ready for that, I strongly suggest that you have a discovery call. We can discuss in more details on whether we can work together and how we may be able to help you. Thank you for watching this video and see you soon.